Today, I'll be speaking with Dr. Vin Gupta, MD, to talk about the reopening of schools in the country and what states with rising COVID-19 cases should do in order to reopen.
It's becoming increasingly clear in many states that the country reopened too early. Now that we are weeks into the reopening process, what can be done to slow the spread of coronavirus?
It's going to have to take a return to science, unfortunately, and which means that we're going to have to make some hard decisions as a country, and all of them require trade-offs that are going to be personally intrusive. And I worry whether or not we can marshal that type of public cooperation that we need to ensure that uh, an intervention like social distancing or masking is actually effective. It sounds like a broken record because it is, but a lot of these interventions, shockingly, have not been all that effective because we don't have broad adoption. And you can't say it enough. If your leaders aren't messaging appropriately in the setting of a once in a century health crisis, something that none of us are used to, we've read about, but none of us have really lived through this. Um, all you can rely upon, Jaden, is public trust and public cooperation, and the two are interlinked and are dependent upon leaders that are messaging consistently, that are messaging the right messages, and hopefully those that are evidence informed. And if you don't have that, and in our case we don't have that, we have a president and his surrogates who are not saying the right thing that's rooted in scientific evidence, whether it's on masks, whether it's on that return to school, on where our testing and where just the overall landscape of this outbreak is right now. They're saying things that just don't make sense to any of us who know better. Then it's going to create an adversarial, tension-filled relationship between public health officials, doctors, nurses, you name it, and elected officials in power. And that's going to cause people to say, well, I'm going to believe what I want to believe then, not what I should believe. And it's created a lot of skepticism, and I think has challenged us as a country to tackle this in a unified way, which is why we're still battling this problem. And our colleagues in the EU or in the Asia Pacific are actually doing quite well. All things being considered, they're actually doing way better than we are. And they also saw the worst of it at one point, but they've managed to have collective action. We just haven't been able to do that.
The president said he didn't agree with the CDC's guidelines, basically saying he doesn't care what the experts think. I want to know what your thoughts on the CDC guidelines were. What did you think about them?
I didn't think they went nearly far enough. And I think this goes back to the mixed messaging piece. For so long, Jaden, since I've been doing this in the public arena since March, it's been testing as the backbone of any sort of return to normalcy strategy, and that makes sense. We want good, accurate testing that's quick to inform who could go back and engage in semi-normal ways with other people in close distances and who shouldn't. And now we're saying, well, maybe we don't need to do that in the use case of returning to schools, and that doesn't make any sense. Obviously, that doesn't make zero sense, because the data that exists right now about children transmitting it to other children in school settings, indoor classrooms, is really, really sparse. But you're seeing the president's top surrogates really message hard on it. Secretary DeVoe. You're seeing Admiral Gerard just in the last 48 hours basically saying, well, there's without any reasonable doubt that children are not going to get affected. And it's pretty clear that children may not pass this on to teachers and to their parents. There is no clarity, Jaden. There's a few small studies that suggest children are not as effective at transmitting COVID-19 as adults. Fine. It doesn't mean that the risk is not zero. It doesn't mean the risk is not zero to you or to your classmates that you might have a bad outcome from COVID-19. Is it less? Yeah. Is it completely zero? No. And what about the risk to teachers and parents? still very prevalent. We just don't know. I guess is the point here. We don't have enough data. And now we're saying, well, because we need to reopen the economy, because school reopenings are really critical to reopening the economy in time for the election, let's do it. And all the data aligns. That's false. And that's a false narrative. And it's going to harm people. And so that's the type of problem we were having here. I don't think it's a lack of not knowing what to do. It's more of, is there the political will to do it? And do we have people that are going to be courageous enough to say, you know what, it doesn't matter if I'm admiral this or secretary of that, this is wrong. I'd rather resign and protest than stay here and be a mouthpiece for a wrong policy. We don't have, unfortunately, that phenotype in the current administration. We have a bunch of people who are not willing to do the right thing. And even if that means we don't know, and saying we don't know. So we just don't have enough humility right now in our highest levels of government, and that's causing problems.
The president didn't consider the impacts on older people when it came to reopening schools. So what could be the potential dangers for older people like teachers or even janitors and other people like that?
Significant side effects and significant risks. Jaden, what we know here is that for every increase in age, every year increase in your age, you're likely to have a worse outcome from COVID-19 if you're infected. And so our teachers, those certainly above 55, those with pre-existing conditions, any adult really, but certainly those that are older or with pre-existing conditions, we know don't do well. And that's incontrovertible. And if I'm a teacher or if I'm a teachers union and I'm seeing what's happening here, I'm thinking to myself, well, in a very somewhat similar situation back in March, weren't doctors and nurses and respiratory therapists on the front lines, chronically exposed, causing a lot of hay when it came to lack of testing, lack of PPE? And here we are almost going to a very analogous situation. Where's our testing? Where's our PPE? That needs to be, if I was them, I would wonder, those are the questions I'd be asking. And they are asking that. You saw LA Unified School District, San Diego, move towards fall semesters online. Listen, nobody wants normalcy more than doctors and nurses and respiratory therapists and your public health professionals. We want normalcy more than anyone. But it's not going to get there until we get a handle on this pandemic. There's no middle road here where a solution to the pandemic isn't central to normalization. And that's the problem here. You're having people attack Dr. Tony Fauci, whom all of us on the medical side deeply respect. And they're attacking him in the most insensical way, saying this is an individual who doesn't have the full interest of the nation at heart, which doesn't make any sense. He wants to contend with this outbreak in a meaningful, evidence-based way. If we do that, we have normalization. Then life goes back to normal. But there's no other path to normalization. And so for all your viewers out there, question immediately anybody that is trying to sell you something that doesn't make sense at face value. There's no way out here that's easy. But other countries have done it. And the only reason we haven't been able to do it on the same timeline is the lack of effective leadership. That is the only reason, unfortunately.
For those who aren't aware of why they should wear a mask, what is the science behind masks?
The science behind masks has greatly increased in the last 3 months. I would say in the early part of 2020, we didn't know a lot about masks, one way or the other. You know, there was nothing to say don't wear a mask, but there wasn't a lot of compelling data to say, oh, well, that's going to save your life. So there was uncertainty, but there's no data piece out there that says do not wear a mask. There was just uncertainty, and so anybody who claims ignorance, like the Surgeon General, on, oh well, you know, we have evolving data now, it makes sense to wear a mask. Back in February, there was no data piece that says don't wear a mask, a homemade mask. But people have chosen to cherry pick data and engage in revisionist history. We've learned that masks, which certain countries have adopted in public use during the flu season every year, like in the Asia Pacific. Now we've learned that masks look like they're really effective at reducing the transmission of COVID-19 from those that are infected. So if you're infected, whether or not you have symptoms, if you cough, you're going to release droplets of spit from your mouth. You might see it on your iPhone or on your computer screen if you're just talking at it. That's droplets. We also think that those big droplets tend to fall on the ground close by in a radius of about 6 feet around you. But there's some droplets that get released. Those are really small ones. We call them aerosols. It's confusing. But those small droplets, aerosols, get airborne, meaning they get launched, and they get launched for maybe up to 12 feet. So they go longer distances and they can stay in the air for longer periods of time. That's airborne transmission versus droplet transmission. We think COVID-19 can do a little bit of both. Tuberculosis is a common airborne transmitted disease. That's why anybody that has TB, you want to wear an N95 mask around them, because that protects against those small droplets that TB is known to be transmitted by. Something similar with COVID-19, we think. So that's evolving data, that N95 masks actually are useful for healthcare workers because they're constantly getting exposed to these small droplets. The question I am now getting asked more and more is, well, Doc, if we think COVID-19 is airborne transmitted or through these small droplets, and you protect yourself in the hospital with an N95 mask from those droplets, why don't I, in the American public, why am I not able to access to the N95 mask? It's actually a great question, and the answers to that are probably not going to make anybody happy. But number one here is that we just don't have enough. Point of fact, we do not have enough N95 masks to disseminate. And anybody that tells you a different answer is just lying to you. That's the answer. There's not enough N95 masks for healthcare workers. We have to reuse them, and they get recycled, much less for the American public more broadly. So that's one. Number two is, well, we think that maybe the best way here is to mitigate your risk of getting exposed to to these small droplets, these airborne particles of COVID. And the best way to do that is to avoid indoor dining, only go into indoor settings with other people that you don't know for essential tasks, and do so quickly. So grocery stores is a prime example, and always wear a mask. That's why we're saying, and then potentially even shelter-in-place laws, but that's why you're seeing this movement towards closing indoor bars, indoor dining facilities. I'm a big believer of doing that. But the idea there is risk modification as opposed to saying, hey, everybody needs an N95 mask. But that's also going to be a big issue in schools. Teachers are going to probably ask themselves, if I have to be in an enclosed, largely indoor space with children who might be infected without them knowing it, and we don't have a test on everybody because we just don't have testing, then why am I not, and why are the children not wearing N95 masks? It's just not that different than being in a closed clinic with an infected COVID-19 patient in a hospital. It's a very legitimate question, and nobody who's in a position of power right now probably wants to answer it, because you know what, it's true, and they don't have a good answer, because it's going to require money and political will to address that problem, and there's a dire lack of both right now.
So what is the danger that misinformation presents as a deadly and sometimes non-deadly virus plagues our communities?
All of the above, Jaden, that we've just talked about has been and will continue to be impacted by disinformation. And disinformation can be subtle. It can be obvious. An obvious example is the president not wearing a mask when he's been repeatedly asked to, or the vice president not wearing a mask at Mayo Clinic a few months ago when everybody else around him in a health facility was wearing one. That's the type of adversarial disinformation campaign that those two have engaged in, I think, to poke back and to really push back, frankly, on public health experts that they view as adversaries, sadly. And so that's disinformation, because then people see that, and those who don't want to wear masks, because masks, nobody wants to wear a mask. I mean, let's be honest, nobody actually wants to wear a mask. You know, another example of disinformation is what you're seeing with media personalities. And Laura Ingraham today, or yesterday rather, attributed a vote for Joe Biden in 2020 with a vote for another lockdown. And that's the type of really, and some level it's nuanced, but on some level it's very obvious what she's trying to do. But what she's basically doing is she's creating a fear campaign around the election of Joe Biden, saying that he's going to lock down the country again. You're going to lose your job if you vote for Joe Biden. Even though what's really happening here is no one wants to lock this country down. We'd only do so if it was to save American lives at scale. And yet she's creating this narrative here that, well, a vote for Joe Biden's going to cost you your job. No, in fact, no one wants to go down that route of another lockdown. That lockdown, if it needs to be done, and we're worried it might need to be, is like using military force in a just war. No one wants to do it, but you have to do it. As patriots, we say, okay, let's try not to disagree on this, and let's march so that we can save American lives and maybe the lives of others. These are difficult decisions, but the more we politicize them, the more, one, we're not going to do the right thing, and then two, people are going to get confused, and there's going to be discord on things that other countries haven't even remotely disagreed on, and it's going to create all types of rhetoric and conflict that I think we're all tired of.
Who are the people Americans should rely on for accurate and insightful information on the coronavirus pandemic? Because the White House has made countless attempts to discredit Dr. Fauci, who's an expert in this and who knows what he's talking about.
It's a tough question. I don't know the answer to that. I wish I knew. We have a dire lack of leadership right now in this country, and as a result of effective leadership. And I'd like to think that those of us that are on the front lines are trying to message at a high level consistently. I've been trying to do my part, others have been as well, that we're trying to counter punch to the extent that we can and counter message and try to save lives in the process, hopefully. There's only so much you can do though, when you don't have, you're not at the podium with the seal of the US presidency on it. He has power that none of us have to influence and to shape policies and to shape mindsets. And so no one can be a substitute for the president of the United States. And so in his absence, people are going to have to, I would recommend that people read broadly, watch broadly your broadcast news. I'm not saying watch MSNBC or Fox News. Watch a few shows. I mean, get in the habit of getting your news from a few different outlets. Read, to the extent possible, periodicals that you trust. Try to get past just the 2-second bullet on a news segment. Try to double click here on some of the evolving science. And I would say both the Wall Street Journal and the New York Times, regardless of your political affiliation, tend to at least report the facts as they are presented in certain sections of their non-opinion pages. But again, those are two periodicals well esteemed from different sides of the political aisle. I would just say in this, avoid getting your news from elected leaders at this point, frankly, on either side of the aisle, because everybody has an agenda. The best place to get it is through unbiased news. And I think that people should make up their own mind about who's telling the truth. So that's sourcing from a lot of different lenses, in my view, both news media, on TV, in print, to the extent that people are willing. I know sometimes it can be hard to access it and to really make sense of it, but scientific literature, there's some interesting podcasts out there that are accessible on smartphones or via your computer, from the New England Journal of Medicine and the Lancet, that, in my view, will allow people to get the unvarnished truth. And but it's going to require active engagement. Jaden. There's no passive engagement here. Usually we can get our news passively on Twitter or wherever you want to get your news, and you're going to make up your own mind here. Here, to me, because there's so much disinformation, you're going to have to be an active consumer of it. You're going to have to seize it and filter out what you don't like. But everybody needs to make up their individual mind. And I suspect the majority of people, when presented with the facts, will find it hard to ignore them, and will be able to better parse out what's fact from fiction.
Is there anything else you would like to add to this universal discussion?
You know, what I would say is, I think this is unfortunately going to get worse before it gets better. And that's an exhausting thing for me to articulate, especially to viewers, your viewers, many of whom I'm assuming are back in Toledo, my hometown, where my wife's family still live. Toledo means a lot to us, even though we're now on the West Coast, still close in our heart. What I would say is, trust what scientific experts say, because at the end of the day, they have, even if you think somebody has an agenda, they have less of an agenda than any political leader on any side of the aisle. And every public health expert, scientist, doctor, you name it, is saying the same thing roughly, that this is going to get worse, that we need to be more mindful about what type of mask we wear, not just wearing a mask, but what type of mask do we wear? And be an active consumer of information to the extent that you're able. I know it gets exhausting out there. I'm tired of it. I can't tell you how discouraging it is sometimes. Every day it's a bad headline after bad headline. And it seems like you're fighting constantly this stream of misinformation. It's like, why are we not banding together and just dealing with this together as a country? Not only do we have this pandemic, but we're having to battle almost the same political battles we had to on other issues. It's exhausting. But I would encourage all of you to just be active consumers of information. Make up your own mind to some degree, since you're not getting told the right thing from people that should be saying the right thing. Our Surgeon General, our President, people that have been put into places of privilege and power for a reason, are failing us. So it requires all of you to be active consumers of information, to make your own mind, but then always to err on the side of caution and be conservative in terms of what you do.
Dr. Vin Gupta, thanks for joining me.
Thanks, Jaden. Thanks for having me, buddy.